Hello, everyone. We're back. Lisa Wessel with Encompass Women's Health, and me, Diane, her trusty sidekick that just interjects random questions or thoughts
They're great. They're great.
throughout the conversation. Today, we are talking about insurance, and there's so much about the healthcare system that's broken. We know that. There's also this fear of not having insurance. And oh my God, what is going to happen if I don't have insurance, especially for women who are going through perimenopause, menopause as they transition later on in life because you're getting to the end of your work career and there's this terrifying gap of maybe when you don't want to work and when you can get Medicare that can be, decades sometimes. And
Yeah.
this fear of I have to work because I need insurance, I need my kids to have insurance is real and dictates so much of the decisions people make in their careers and deciding to stay. I am part of that.
Yeah. Golden handcuffs.
Yes, the golden
People are tied
handcuffs.
because of that.
When I retired it was terrifying because I was like, "Oh my god, I don't have insurance." And I spent months trying to figure it out and, we came up with a solution. I think this is a very important topic that
Yeah.
has to do with everything. So take it away.
Okay. Keep in mind that I am a nurse practitioner, I'm not an insurance agent, I don't work for any sort of I'm gonna just kinda give my thoughts on this. So this is like an opinion piece, I guess, more than
Correct.
anything else, to be fair. So I kind of like to start, do I think insurance is important? Do I think it plays a role? Do I think people need insurance? And I would say I think there's a time and a place. Most of us, we need something in this day and if something were to happen, right? I'm a proponent of some sort of something. Right now, I'm really leaning towards having a high deductible when and using that HSA, being able to put money away into your HSA because you can build that up. You can use that long term. You can invest that money. We're paying $800 out of our own. His company's probably putting something in there. Now we have 3 kids. They're still on our, but it's a lot of money. Are we utilizing that? And the thing about insurance is you are paying for negative things to happen. They're betting that you're not going to need it and you're betting that you are. Okay? That's what insurance is.
Mhm.
That's what we do with the house and the car and you're paying. So if you look at how much money you're putting in monthly, could we better utilize that in a different way? I think there's a time and a place. If I'm getting ready to have a baby, do I want to have, do I want to have an HSA? If I have saved up, and usually a high deductible means that a high deductible is once you're going to pay the first, whatever it is, 10,000, and it's a high deductible. So hence its name. So it's not a low deductible. It doesn't get to be a $2,000 deductible. No, it's going to be a 10,000, a 15,000, a 20. I think as a society, and again, that's a lot of money, but if you can build that up and save that and that's sitting there and you're investing that and that's making money, but I have that money specifically set aside for a catastrophic event. Can I pay the deductible? And if you can, then great. Now it does take some time to build up to that. And then once you've met that deductible, then your insurance takes over. That can be super helpful for people. And partly because on the day to day, you know, if you're healthy and nothing's really what do I do? What's my thing? Okay, I get my well woman exam. How much is that out of pocket? I don't know. At my office it's $200.
Mhm.
How much is it to get my teeth cleaned? 60. I do this an extra $64. Um, Insurance has decided that my mouth and my eyes aren't medical. like,
Right.
what does that mean? How do you you know what? We're going to take that body part out. That's a separate thing. And this is a separate thing. How is
Mhm.
that even freaking possible? There's always a self pay option. Now, granted, I don't take insurance, so maybe I'm partial to that. But when you take that piece out and you take out insurance dictating, that allows for the time. That allows for the ability to spend time with your patients. That allows you to set the amount. Insurance decides what they're going to reimburse your provider, and everyone pays insurance and they pay a shit ton for it. So they have different expectation of I'm paying for this. So I want this. And I think some providers, when you're in it, you're like, yeah, you know what I'm making off of this? This appointment, $40.
Yeah.
like, and it's really hard to swallow. And you can't have someone come to you. I can't get anyone to come to my house for $40, like, or 200 for that matter. That seems like a lot for someone to pay for a well woman exam. Anytime like anyone comes to my house, it's $500 to fix
Mhm.
anything. A little bit of perspective with that. But I think the point is there is always a self-pay option, even if you have insurance. So women tend to like what I end up seeing a lot is women where the recommendation is to like alternate. You need an MRI every 6 months because of a strong family history of breast cancer, and then you need your mammogram. Well, does insurance cover the MRI? No, they do not. You're going to pay a portion of that. Finding places or asking the self pay, like I'm going to do this, but I'm not going to use my insurance. Is the rate better? Almost always. That is wrong. That like I have insurance, I'm paying $800 a month. And if I need an MRI, my insurance doesn't cover it and I'm going to pay $1,500 when if I said, what's the self pay price? It is it, usually 800, 500, 800. Like it's much, much less. You
Mhm.
can, if you need an ultrasound, let's say you need a pelvic ultrasound, and you use your insurance, you're going to pay your deductible or whatever that, like they're going to charge $500 for that ultrasound and they're not going to cover it all. There's going to be a reason and you're going to pay $200. You can get a pelvic ultrasound for 130 out of pocket at most places.
So, real quick, why is that? Why is the self-pay option so much cheaper than insurance or the cash option across the board?
I don't know that for a fact, but it's like they are hedging their bets. This is what they're allowed to bill and like how much people pay into the insurance piece of it. But like it's a money maker for them. So that's why.
Well, potentially another reason could be they're not having to do any of the headache of billing insurance and waiting for payment, right? Is
Yeah.
that are
Yeah.
we saying the same thing? Like,
Yeah.
hey, you can pay the cash option. After I ruptured my Achilles, they said it's the cash for physical therapy was $90 a session, and they're like, "But your insurance says it's 80." So there was a $10 difference, and there was a little something in the back of my head that's like, "There's no way my insurance is great is gonna cover all these visits." Well, they didn't, so I ended up having to pay the difference,
Yeah.
and over time, I paid a lot more
Mhm.
than had I just paid the cash option.
Yep. Yep. And the billing's different, right? And so, like, for
Yes.
myself, one of the things I realized is like, let's like prior authorizations. Like, what does that
Yes.
mean to the general public? That means that, like, Diane, I really would like you to be on this medication. This is the best, for whatever reason. I've decided this, or I think this is going to be the best choice for you. And your insurance isn't in bed with that pharmaceutical, essentially. So they're like, it's not on the formulary, which means that we don't really want her to be on this medication. We want her to be on this medication because we are in bed with this company, not this company. We're not necessarily saying no, but like, give me a good reason. And so then you have to do a prior authorization. Well, I am a small private practice. It is just me here. I don't have anyone, I don't pay anyone to do that. And I realized the first time I was like, do you know how much time this takes? Like,
Yeah.
number one, I have to sit down and I have to fill out a form. It's never ending. What's happened in this space is in order to provide this or be able to do this, I have to hire someone to do this. And that's their full time job. And so you're
Mhm.
like, so I have to take my business or like any business, anyone in medicine would have to go, okay, well, I'm going to hire someone. Now I have to pay that person $3,000 to take care of the insurance side of things. So what do I have to do with my prices? Insurance does. It's a little ridiculous what they're able to dictate, what they're allowed to pay for things, what they will pay, what they won't. So I think that's the biggest thing. And that's the frustrating part of it. And that's where I do kind of go back to the high deductible plan in my brain. Now I like it's hard because people are like, yes, I have kids. Yes, this. But if we kind of started, I had this discussion the other day with a couple that are getting married. They're 24. They were asking me like about insurance. What do you think? And I said, I think you should get a high deductible. Now the mother was like, yeah, but if you start having kids, and I was like, it wouldn't matter if you can save up now. If you're 25 years old, and let's just say you're gonna have a baby in 3 or 5, like 5 years. So you're gonna have 5 years to contribute to this HSA, get that money up there. Like, you don't it wouldn't matter because if you
Mhm.
can pay for that, and there's a self-pay price for everything. And I think that's the thing we forget about. Like, I got a bill when my daughter was, in the hospital for 5 days, was she was sick as hell. Yes, that was super helpful, but I still owed $5,000. Okay, yeah, I will pay that. I'm paying you $100 a month.
Mhm. Right, and the law in Colorado, they can't charge interest on it.
You just pay it.
Pay as much as you can for as long as you
Absolutely.
can. But there's an HSA, which is a health savings account, and then
Yeah,
there's an FSA, which is a flex spending account. The flex spending account, you have to spend those funds within a year or they go
correct.
away. A health savings account, you can accumulate over time, you can invest and grow it and it never goes away, which is fantastic. And my question, do you when patients come see you, can they pay you out of their health savings account even though you don't accept insurance?
Correct. Yeah. Yeah,
Perfect.
yeah,
That is
and
great.
you can use those for it just depends on the facility. I can use it when I go to physical therapy, you can use it at other providers, you can go to Walmart and get your sunscreen, you can get ibuprofen, like all of the things. So, it's super helpful, feels like free money. So, you have to figure out, like, how much what's gonna go on with my kids, what do I need to plan for? That just reminded me of my son, we probably have to plan on the whole point of this is always ask the self-pay. Don't just assume that your insurance is going to cover something, whether it's lab work, procedure. You'll have to be very specific. Insurance is fairly tricky. Like you're going in for your colonoscopy, and it is a screening colonoscopy because you're 45. But if the facility isn't in network and if the provider isn't in network, you need to know those things because you could get a bill.
Yes.
Um, you
Even the
know,
type of lab, if you go to Quest versus LabCorp, it
hmm
can be
hmm
different what your
yeah.
insurance will pay
Yeah,
for.
the other thing that I always find too is that's interesting and a little frustrating is they'll be like, "Hey, it's likely that you're," like they'll make a whole thing because they want to get paid. Your insurance is only going to cover X amount, so like you owe this amount. And the answer is, great, bill my insurance,
Yep.
and I'll deal with that then. Like
Yeah.
I'm not, I'm a really proponent of like, no, I would not pay anyone
Mm-mm.
anything because you're not it's gonna take a long time to get that money back if they're incorrect, and so I would say, like, bill my insurance, let it go through explanation of benefits, and then if I get a bill, then I will take care of it, and it's the same thing with LabCorp. If you got a big bill, um, then you can pay that over time. Like, I can't afford to pay this to you,
Right.
but typically, there's things that you can do. I know for myself, it's like, "Okay, well, I'm gonna switch that over to my account, and I'm gonna get a better rate." And it's not
Mhm.
going to cost you that much.
Mhm.
Insurance is notorious to not want to pay for vitamin D. Vitamin D for a lot of people it depends how it's coded, and no one knows how to code it because no one will tell us how to code it because it's a game. Screening for high cholesterol isn't considered preventative. Is family history? Is it like what does preventative mean on the insurance end? Two
Right.
different, and they won't tell you.
It makes sense for the calcium scan,
Mhm.
MRI. A lot of what you've just talked about is to find standalone facilities,
Yeah,
maybe give a better rate because 'cause they're not attached to a hospital. Same with surgical centers. They're separate entities advocating for yourself and
just ask.
asking the questions. They know what the cash pay
Yeah,
is. They know.
they totally know what it is, and it's easier for them, they get paid. There's not that 40 paying someone to take care of that, that's easy for them as well too, they're getting paid, it's done. I think it's a weird dynamic because it's money, and we are uncomfortable to ask that, like, but don't.
Mhm.
I mean, I think that's the thing, like, things are tight, things are rough, it's hard for everyone. The point is, you are the consumer, and you can, like, ask the question,
Mhm.
and get a good informed and maybe spend some time. It's hard because if you get on that phone with insurance, you're never getting that time back. But ask, and I would say sometimes it's like I don't know the verbiage to say. I'm getting lab work done. What do you need? I'd like to have an idea of what this is going to cost me. These like they usually want the ICD-10 codes. They usually want the number. Like, can you give me an idea? What like is this covered? And you get a different thing every time. So I always recommend whoever you're talking to take their name and say, can you reference this call? So there's a
Mhm.
number that gets referenced to that call. So I'd like the reference of that call so that when this is not correct, I can call back and have a
Mhm.
discussion again.
And if you do have insurance, take advantage of the preventative,
Mm,
woman
yeah,
exams. Like a lot of insurances will cover that type of stuff because, like you said earlier, they are betting on you getting sick and something bad happening. So they're not worried about the preventative stuff,
yeah,
which
that's covered. That's
early
covered.
detection is key.
Yeah. Yep. Correct.
Awesome.
Absolutely. Look into it, ask questions. I think that's the biggest thing. If you have your insurance, like find out all the things. And we really need a course, all of us in insurance and how it works.
Healthcare reform is like chasing rainbows on unicorns.
Oh, there's no answer. Yeah.
All
All
right.
right, guys.
Thank you.
Yep.
Bye.